Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. And in this video segment, I'm going to review what clinical studies are still available with the Alpharadin in prostate cancer. So let's look now and see clinicaltrial.gov. And we found 10 studies on the subject of Alpharadin with prostate cancer. So when we look now at the list of the study, we see that there are some studies that are still recruiting and some studies that are completed. So let's go first and look over the whole list of the study. So the first study is a study of Alpharadin with Taxotere in patients with bone metastasis from castration-resistant prostate cancer. The second study we see here is completed study of Alpharadin for palliation of painful bone metastasis in hormone-refractory prostate cancer disease. The third study is a phase 3 study of Alpharadin in patients with symptomatic hormone-refractory cancer with skeletal metastasis. This is active but not recruiting, but it was not published yet. It's not done yet. Another study they are recruiting is Alpharadin in castration-resistant hormone-refractory prostate cancer patient with with bone metastasis. I'm going to open some of these studies in order to help you try to find the location where are the studies and a bit more information. Another completed study is the Alpharadin in patient with hormone-refractory prostate cancer and skeletal metastasis. Let's look at available now. It's a study of Alpharadin in castration-resistant prostate cancer. We'll have to open it. Completed a placebo-controlled phase 2 study. Another completed study, a dose-finding study for prostate cancer patient with bone metastasis. Then we have a recruiting study that checked the safety, biodistribution, and pharmacokinetics study of this substance in Japanese men. And then another study, Alpharadin, safety and dosimetry with HRPC, hormone-refractory prostate cancer, or what we used to call castration-resistant, that had metastasis to the skeleton. So we are going now to look open up a few of those studies and try to discuss it. Let's go now and look at the first study recruiting patients. And this is a study of Alpharadin with Taxotere in patients with bone metastasis from castration-resistant prostate cancer. So let's open this study and try to see what information we could get. By the way, I recommend all of you to try to get on clinicaltrial.gov and try to help your doctor looking for studies and try to read it. There's some very valuable information. I'll go over the study itself. I will not go into details about what are the criteria for participation, but I would mention at least the place where the study is done and the contact information. So let's go now to the first study. And we see the purpose of the study. The main purpose is to establish a recommended dose of Alpharadin to be used in combination with Taxotere in patients with bone metastasis from castration-resistant prostate cancer and to investigate safety and explore efficacy of the recommended dose. So let's go now and look. This is a phase 1 to 2A study. The estimated enrollment is of 60 patients. They started in July 2010. The estimated study completion is December 2013. Let's look now and see where are the studies done. So first of all, about contact and information. There is a contact information here to two locations. There are phone numbers here that seems to be the same, and there are probably phone number of the company Algeta who sponsored this study. So you see the phone number here is 472300790, and here is an email address which is mariannelonmo@algeta.com, and here is another contact phone number of Anna Christie Askness, PhD, and this is the phone number here, 4723007990, and here is the email address. And you could stop the video if you don't have enough time to copy this email. But look at the location. Where is this study done? In the United States, in Maryland, in Baltimore, The principal investigator is Hans Hammers. And then we have Dana, this is in Johns Hopkins. And then we have a Dana-Farber Institute. We have recruiting patient now. It's in Boston, and you could try and call them and find out. The name of the principal investigator is Christopher Sweeney. And then you have in New York, our famous cancer center, the Memorial Sloan Kettering Cancer Center, and Michael Morris is the chief principal investigator, so you could call there. Let's go now and look at other studies. The second study I want to show you is recruiting now. It is also Alpharadin in castration resistant with bone metastases, and let's see this study. What have we got here? It's the main study. It's a prospective study. It's interventional. It's open label, multi-center, early access using this Alpharadin on the same group of patients. So let's go and see where the study is done. But before that, we see the estimated enrollment is 2,000. The study start date, and they just started in July 2012, so probably many locations did not start yet. The estimated study completion date is April 2015. So let's go now and try to see where this study is done. So we see here that the sponsors are the Bayer drug company, and there is an email here to contact them, which is clinical-trials-contact@bayerhealth.com. And there are 184 study locations. Probably most of them did not start yet, but they will be available in many countries. And you see the list here in Belgium, they didn't start recruiting yet. In the Czech Republic, they didn't start recruiting yet. In Denmark, they didn't start recruiting yet. And you see there is a long list of places in France, in Germany, they didn't start recruiting yet. Let's see, in Ireland, didn't start. In Israel, it's interesting that they start recruiting in Kfar Saba in Israel, and you have the location number, I guess. So Israeli guys could get the studies in Israel, otherwise not yet recruiting. Also in Italy, not yet recruiting. See many countries, many locations. This looks like more other countries, not United States. Some places were terminated, not clear why. In the Netherlands, in Norway, in Spain, and in Sweden. So we should wait in Switzerland and the United Kingdom. So we should wait patiently and see when can we join those studies. The sponsor again is Bayer, and the study director, they don't give the name of the study director, but it's directed by this drug company, and you could get in touch to Bayer representative through your doctor that has connection to the drug representative, and maybe you could find out when it's going to be available locally in your neighborhood. Let's go now and look at another study. So let's go now and look at this study which is available, Alpharadin. Let's see where it is. So the purpose is, again, prospective, interventional, and they say it's available. So let's see where it is available. The study is available. Contact information is clinical trials at Bayer again. Location here in the United States. It's in Arizona, it's available. In California, in Stanford, it's available. Tampa, Florida is available. New Orleans, it looks like patients in the United States are more fortunate to have this study available. In Boston, it's available. St. Louis, Missouri, it's available. Las Vegas, available. Pittsburgh, available. And in South Carolina, and in Texas, and also in West Virginia. So we see here in the United States is available. Let's go now to the next study, which is recruiting, biodistribution and pharmacokinetic study. And it's a Japanese man, so I think it's probably done in Japan. So let's try and see about this study. This is an uncontrolled, open-label, non-randomized phase 1 study to investigate safety, biodistribution, radiation dosimetry, and pharmacokinetic of a single dose in Japanese patient with castration resistant. So probably it's done only in Japan. Let's see now where are the location. And indeed, it's in Japan. They started only recruiting in Yokohama in Japan. The other location they did not start recruiting yet. So it looks like there is a lot of activity ongoing and more will be coming soon. I just hope that we'll get all this information to the FDA. So finally we'll be able to use the Alpharadin as a tool fighting cancer in the bone even early before it's causing pain, even early before you see it on the bone scan, even early at the stage you see it on the sophisticated, either the colon 11 scans or better yet, sodium fluoride PET scan, and we'll be able to use it and monitor the response to the treatment by using those sophisticated scans. Stay well, stay informed, keep stalling, more good treatment are coming your way. Take care. Goodbye.